So first most common cause of nephrotic syndrome is membranous proliferative glomerulonephritis. So membranous proliferative glomerulonephritis is divided into type 1 and type 2. Type 1 is associated with the hepatitis B and C infection, while type 2 is associated with C3 nephrotic factor. So in patients with type 2 membranous proliferative glomerulonephritis, which is associated with C3 nephrotic factor, this C3 nephrotic factor is usually converted into C3A and C3B by C3 converters. So this C3 converters normally is rapidly destroyed. But in this patient, there is antibody which will stabilize the C3 converters and make it to stay for a long time. So which will lead to continual formation of, which will lead to continual conversion of C3 into C3A and C3B. Then this C3A and C3B, it will activate the complement continuously, causing continuous inflammation and the inflammatory injury within the glomerulus, which will lead to microalbuminuria, causing nephrotic syndrome. So fifth most common cause of nephrotic syndrome is diabetes mellitus. In patients with diabetes mellitus, usually the serum glucose is elevated. So as a result of serum glucose is elevated in diabetic patient, it causes non-enzymatic glycosylation of vascular basement membrane. What I mean by non-enzymatic glycosylation of vascular basement membrane is just the blood glucose will stick to the vascular basement membrane without enzyme conversion. That is why we call it non-enzymatic glycosylation of vascular basement membrane. Just it is just accumulation of the glucose in the vascular basement membrane. This non-enzymatic glycosylation of vascular basement membrane, it leads to hyaline arteriolosclerosis. What I mean by hyaline arteriolosclerosis, just narrowing of the arterial lumen. And this narrowing of the arterial lumen, it usually occurs in efferent atrial, which will cause squeeze of efferent atrial. As a result of this squeezing of the efferent atrial will be blocked. When the efferent atrial is blocked, it will create backward pressure. This backward pressure, it will increase glomerular filtration pressure. So when the glomerular filtration pressure is increased, it will lead to hyperfiltration pressure within the glomerulus. This hyperfiltration pressure within the glomerulus, it will cause hyperfiltration injury within the glomerulus. This hyperfiltration injury within the glomerulus, it will cause sclerosis of the mesangium. This sclerosis of the mesangium, it will lead to microalbuminuria.